Hello and welcome back to Silvia's Health Hints with our summer edition. That's why I'm here in a park of Florence, which is called Giardino della Villa il Ventaglio, which is a park in the area Campo di Marte. When you go in the direction to Fiesole, which maybe someone knows. It's a garden which is not so known, but it's a really nice garden and I really recommend you to come here and see this garden. Today I want to talk about HIV testing and what you can do if you tested positive for HIV. HIV testing is normally part of the STD screening. So a lot of my younger patients are doing STD screenings, and HIV is part of this screening. While in some countries STD screenings are offered for free, once or twice a year a patient can do it and don't need to pay anything. In Italy it can be done only privately, and it's pretty expensive. If you do an STD screening and HIV testing is included, you need to sign a consent form, and a positive result is subject to report. Nowadays, normally the first HIV test which is done is the so-called ELISA test, which is an immunological method to detect certain molecules. It detects antibodies for the two types of HIV, type 1 and type 2, and in some labs nowadays also the P24 antigen of the viral envelope. This is the so-called fourth generation test. As you can understand, it takes some time until you develop the antibodies. So how fast the test can be positive depends on the infection dose. This means how high the viral load is in the person who transmitted the disease, who infected you. This depends, for example, of if the person knows to be HIV positive and is on treatment, or if it's a person who doesn't know to be positive for HIV and is not treated. These persons normally have a higher viral load. So if the infection dose is high, the test can be positive already after 5 days after the infection. But according to the recent statements of the specialist societies, the time window between infection and a positive test result now is officially 6 weeks. After this period, an HIV infection is not longer expected. HIV testing can be done as a screening or in case of a suspected infection. If there's a reasonable suspicion of an infection that occurred less than 6 weeks ago, the diagnosis can be accelerated by the direct use of HIV NAT RT-PCR tests. So this is a different test, a little bit more specific, and it can be done a little bit earlier. A big problem in HIV testing is the pretty high rate of false positive results. This is really a problem because it has also a psychological impact on people who result positive and think, oh my God, I'm infected now with HIV. That's why a positive test always needs to be repeated. So if the first test is positive, it needs always be repeated and done a second test. But even 2 positive tests in a normal lab don't mean automatically that the patient is really infected with HIV and really positive for HIV. Then there's a more specific test like Western blot, and this needs to be done. And normally when you are tested positive for these 2 tests you've done in the beginning, you need 3 other tests which are more specific and more accurate. And then if you result negative to these tests, which happens, then the test needs to be repeated for another control in 3 months later. So if you result definitely positive to all these tests, already if you result to the first 2 tests positive, you will be normally sent to a specialist for infectious diseases or even a specialist for HIV, who then will perform all the other tests to confirm or to see that you are negative for HIV. Okay, if you take the prophylaxis for HIV infections, the so-called PrEP, you should not interrupt it until you definitely know that you are positive and the real HIV treatment starts. Being positive for HIV doesn't mean that you have AIDS. This is very important. Nowadays, with the treatment, HIV-infected patients can have the same expectancy of life like other people. Important is that you are under treatment and the viral load is under control. That we keep the viral load as low as possible. What happens if you are an expat, a student, and you are in Italy and you, at the end, unfortunately tested positive for HIV? The first thing you need to decide is, do I start my treatment here in Italy or do I go back to my home country? This depends a little bit of what you are doing here. For example, if you came only for half a year, for some months, or maybe even only for a year as an Erasmus student or another student, and your period here in Italy is pretty limited, maybe the decision is, maybe it is better to go back home for different reasons. First, that you have a better insurance coverage in your home country, which will cover then the treatment. Second, that if you start with one doctor the treatment, you don't need to change him. And the third point would be that you have the support of your family and your friends at home. If, on the other hand, your stay is here, your scheduled period is a little bit longer because, for example, you do a PhD, which takes 4 years, or you have some job for 4 or 5 years or something like this for a longer period, then maybe it would be a pity to interrupt your stay here only because you are positive for HIV. In this case, you need to clarify with your private insurance if and how it will cover the costs, because the assessment, the tests, and also the treatment are very expensive. So it's not always, it depends a little bit on what kind of insurance for what purpose you have and if they really will cover. But even if they cover, if they can, for example, directly pay the center or the specialist you go to, or if you need to anticipate the money and then get reimbursed, because the costs for the drugs are super expensive. So it's not something that everybody can afford. There is also another possibility in these cases that you pay, even if normally you don't have the right to have the Italian public insurance, the so-called tessera sanitaria. There is the possibility also for people, for expats or for students, to pay a certain amount for the year, which I'm not sure how much it is exactly, but I heard that it's around 700 or 800 euro for the whole year. Then you have the tessera sanitaria, and you can do all the assessment and all the treatment through the public system, and then you don't need to pay anything. Which is, I think, if you have a longer stay, for sure the better and the most and more economic solution. Okay, this was about being tested, about HIV testing and about getting tested positive for HIV. So the most important thing is don't panic if in the first or second test you result positive, because I already had patients, they were positive twice, and then in further more specific tests they resulted negative. So everything finished very well. So don't panic, but do other tests, talk to your doctor, and then even if in the worst case you result positive, there is a solution. Nowadays there's a solution also for this problem. I hope you liked this video and it was interesting information for you, and we see each other in a week with a new video. Thank you for watching this